Good morning, this is Keith Schmidt with Integrity Data. Today's webinar will be about the Integrity Data ACA compliance solution. So in the GP world, you'll see this should look familiar. This is 2015, and you have down here right in your menus HR and payroll. You also have ACA panel and an ACA import panel. Briefly, the ACA import, you can import different aspects. So you can import employee information. You can also import dependent information, which a lot of companies can do. And this dependent information, keep in mind, is only needed for the self-insured companies. If you're not self-insured, you do not need any dependent information. I know in GP world they provide that at the dependent level. That's not needed unless you're self-insured. So it's just extra work in that sense. Now for our cloud version also, you can import the dependent information, and if you're self-insured, and typically you could get this from your insurance provider. It's a real quick and easy import. As you can see, we're on the import side. So let's go back to the ACA side, and if I go to ACA Reports, and I choose the 1095C report here out of my list of reports for H. Riley for 2018. And then if I go ahead and hit print, okay. So it's that easy. Select the report, fill in the employee range, put in the year that you're printing the reports for, and then here you get the 1095C. Now at the top part of the 1095C is, and this is pretty much a final version as of this point from the IRS. They still could change this by the end of the year, but we think they're not going to, based upon the information we've got from them. So you have demographic information in here. This is the lines 14 is the offer of coverage, and there's about 10-12 codes in here that you can use. The next one is about the cost of the lowest cost monthly premium. What's important here is you could have multiple types of insurance that you offer to your company. Some really good stuff, covers a lot of high deductibles, etc., or low deductibles, etc. You could have a medium version. You could have a low cost version, maybe not so many capabilities, but keep in mind the insurance companies were mandated and required to provide minimum coverage policy to everybody. So one of the policies meets the minimum coverage requirements from all insurance companies in the United States. Now the cost of that is, we'll get into how that's determined, but that is recorded here in line 15. And then line 16 is the safe harbor section, which deals with how do you determine that it is affordable. And we'll look at that in detail. Now you notice here in this particular year that we have, if the code does not change or the dollar amount does not change for all 12 months for an individual, you do not have to fill in the monthly columns. However, you do have to track monthly to make sure they determine. It's just that if we see that every month comes out with 1E, we just automatically fill in this 1E according to the IRS regulations. If you are self-insured, you will have to we will automatically fill in the information on the covered individuals, and we'll have the name of covered individuals, their social security number, date of birth, etc. And this would be the month of coverage that they had. Again, you don't have to do anything or change anything in our system. We know that information based upon the automation that we've programmed into the system. So this is just a real quickie on looking at the 1095C to start with. So let's drill down and see a little bit, how do we get to this information. I'm going to show you 2017 first. Okay, so in 2017, you notice we do fill out the information here in it changes from 2D to 2B in these codes. You really don't have to worry too much about these codes. we can provide you the definitions of those codes in a setup method. There's, those are there in case they add to them or change them in the future. However, we automatically calculate all this information. How do we get this information? So first of all, the first part we're going to do is look at determining your ALE. Are you an applicable large employer? So you need to put in, your pay codes, all the pay codes that would count toward hours, including the ones that are $0 pay codes or unpaid pay codes. So you just simply select all those codes that would apply. We're going to stop there at this point in time. And then what we're going to do is look at the reports here. Let's see, wrong reports. Come back here. Okay. So we're starting with the full-time equivalent or full-time employee report. Oh shit, I hit the wrong button. Sorry about that. So now we're going out there and mining all the data that's out there in the payroll for the period of 1/1/2017 through 12/31. Then this is all based upon how we've set up our system. This would be our measurement period. And again, I mentioned earlier that for this year, for those who have to have over 100 full-time employees or full-time equivalents, this year, you need this data would be always based upon the previous year's payroll data. So you would have to have data from 2014, January 1st through December 31st of 2015 for the 2016 report that you create for the applicable large employer. So, and you can see this is a monthly determination. It's not just at the end of the year, one big number here. So every month you have these numbers. So what we got? Full-time employees. Those are the ones that you check the box that says full-time. All right, so it goes through and counts those up. Now then we go through a bunch of calculations to for the variable seasonal employees, the hours that are over 130 hours average. And those come to 21 employees that met that criteria in this particular month. And then we look at all the rest of them who didn't get 130 hours. And they total up those hours, and basically you're going to divide by the 120, which is not 130. That's a little quirk in the system because they trying to get this paid for, so they lowered the number to 120 to meet the OMB budget requirements when they're writing this law. So it gets more people into the full-time equivalent range. And that's just how the government did that to us. Anyway, that number divided by 120 comes to 34. You add those all up, there's 83 in this month. It goes through, you add up all 12 months, come to 1262 divided by 12, you have come up with an average of 105. So this is the first determination. This number here, 105, will go on the 1094C that gets transmitted to the government. So this report, you'll use it to provide, and we use the same calculation. We just give you the visible report, and we automatically put in the 105 in the 1094C for you. Okay. So let's look at a couple things here. In the company setup, earlier in the discussion, we talked about the monthly measurement period and the look back period. So with our system, you have the ability to select the look back period, which is really your friend. The look back period provides you greater flexibility and makes it such that you don't have to offer the employees your insurance quite as soon. So that's just the way they set it up. Now the monthly measurement period, again, that's any 1 month during the year. If you met 130 hours, you have to provide that insurance on that. Also, you set up the federal poverty line. This number could change every year. and currently the percent that the employee has to pay or can pay, you can't exceed more than 9.56% of the employee's pay this year, and that number will also change over the year. So you can set those up in the company setup on there. And let's see, let me go back there, make sure I didn't change anything. Yeah, okay, we're okay. So let's talk a little bit about measurement periods. And I'm going to pull up my 2018 measurement period. You can set up multiple measurement periods. We've done a lot of analysis and work with this. Quite a few companies determine what we need on this. So we've found out that some companies like to have these by state, these periods, for whatever reason that is. Some companies like to split out these salary versus hourly. We're going to leave this as all. And then the start of the measurement period, typically this would be the first day of the next month. And this coordinates with almost all insurance policies always begin on the first day of the next month. So we're kind of lining this up with your insurance coverage. So we have three periods here. One's a standard measurement period, next is an administrative period, and then a stability period. So let's kind of define those briefly here right from the beginning. So the standard measurement period, this is like the year 2014 data. You can think of it that way. And this also needs to coordinate with your insurance policy. So if your insurance coverage starts January 1st, your standard measurement period would start January 1st. If it starts October 1st, your measurement period would start October 1st on that. You can change these, but you can't, once you establish it for 1 year, you can't change it until the next year. So if you switch companies and policies, you can change that. It has the flexibility and capability to do that. So the standard measurement period is like the testing period, the pass-fail period. And if you come up with 1,560 hours during this period, in this case it's 12 months. Now if it's 9 months, it would be a smaller number. But this is a 12-month, and this is typically what most companies use. And we help you. We discuss this, you know, what works best for your company when we do the implementation with our implementation experts. And then during this period it determines whether the person needs to be offered coverage or not. And these would be people who are already full-time or full-time equivalents, either one, during this whole time period. So for this whole year, they have been employed with your company. And we'll talk about the scenario where they didn't make this whole year date what you do in a minute. So once you go through this, you run a report and determine, you know, does anybody need to be offered coverage? How am I doing? There's an administrative period, and this period is used, and it can be 1 to 3 months. The actual standard measurement period can be 3 months to 12 months, but because the stability period can't be less than 6 months, you would have to use either 6, 9, or 12 months in the standard measurement period. So the administrative period is basically say, all right, you determined Billy Bob needs to get this offer of coverage. All right, we're going to give you some time to up to 3 months to get him all signed up, get the paperwork, run your reports that determined he was eligible in the first place, and then get this all administered. Now keep in mind, the employee, just because you offer coverage, and that's your requirement by law, is that you need to offer affordable coverage, compliant coverage to the employee. You know, they don't have to take the coverage. You know, there's nothing that says they have to take your coverage. You know, if they want to, they can say, no, I don't want the health insurance coverage. Keep in mind that they are under an individual mandate. We're talking today about the employer mandate. So that individual that refuses it, maybe their spouse has coverage for them in another company. Possibly they just are not going to carry insurance, and of course they will get fined under the individual mandate on their 1040 returns. So as an employer, all you have to do is offer least cost, affordable insurance, and that's all your requirement is for this ACA reporting world. So once you get everything done administratively, then you set up a stability period, and the stability period means that this is the length of time that you cannot, even if they fall under the full-time or FTE requirement of less than 1560 during the next standard measurement period, any time during that period, you still cannot take that insurance away from them during the stability period. So if they pass this test here, you got some time to go ahead and get that all administered, but you have to provide that insurance. If they accept it, you're required to keep that in place for the length of the stability period. Okay, so let's take a look at some of the reports around these periods. But before we do, I'm going to point out a scenario. So if I was hired on 10/15 of 2016, I would not be employed for the full length of this period. So what the ACA world has done, they have, for new hires, they have what's called an initial measurement period. So in the initial measurement period, you use again, you choose the first day of the next month. Okay, so if I'm hired on, October 15th, so the first day of the next month would be November 1st on that. So here again, you set up a measurement period, and typically this would mirror the standard measurement period for full-time employees. And then you have an administrative period, which is typically less. It can be 1 to 3 months also. And then again, the stability period for the new hires. Of course, now you got to track, this data based upon this. And we automatically track the codes based upon their hire dates. As far as what codes we put on the 1095-C. So this also helps determine those codes. All right, let's go look at a couple reports. I keep wanting to select eligibility reports. Let's see, not this one. Let me go back. Okay, let's look at the standard measurement period analysis report for 2018. Cutoff date is I think I've got the right date there. We'll find out real soon. Cutoff date cannot be greater than the end measurement date. End measurement date. Oh, that's 9/30. Sorry. Okay. So again, this is for the the standard measurement period. That's that 1-year test period. Okay. So this report would show all your employees and what their status would be based upon this 10/1 of 16 to 9/30 of 17, with the cutoff date being 9/30. All right, so you can see that if you look down here for the 1560 in that range, here's 1152 down here. They're part-time. But here's a 1675, so they're full-time. So here's like a salaried person for 2080 hours. That's full-time. So this report shows you which ones are full-time and which ones are part-time. And of course, these numbers are also dictated on that ALE report we looked at earlier. You would add these up and there would be 28 of the regular full-times, and then et cetera, et cetera. So this is a report that can be used. Next one we have to look at is the initial measurement period report. Cutoff date is 9/30. Let's see if I get everything I need here. Now the initial, and we have Excel spreadsheets. For sake of time, if you want to do some forecasting analysis of your very large company, you can pop this data all into Excel, and or have a link to it, and then run different kinds of analysis over there in Excel to give you an idea for who's going to be coming available. So here, what we got here, this shows us cutoff of 9/30, which are trending. Now remember, this was a initial measurement period report, so we can have up to 12 months in here. Now, some of the employees, they're only 7 months into their new year. They got hired 7 months ago. They got hired 8 months ago, etc. So that's how this report measures. Now, you notice this one here, they got 1058.25 hours so far. So they're trending to be a full-time employee based upon their 7 months that they're going to be full-time on that. Now here's a person who's 11 months along, they've only got 1088, they're not going to make the 1560. So even though they have 1088 hours, but they're 11 months into their employment, they would still be classified as part-time on that. And again, all these calculations are what we use to determine codes on the 1095-C. Then next report we want to take a quick look at is the monthly initial measurement eligibility. And let's do, I think this one here we can do 10, 31, 2017 to, I guess I can't, 09, 30, 2017. Let's try this one. Okay. So this is an important report. So what this does, it takes a look at all your employees on a cutoff. So this is the report you would run after you run your payroll. And by the way, the data for ACA is not based upon check date. It's based upon pay period date. So for example, if you have a pay period of say December 15th through the December 30th, and you cut the checks January the 5th, okay, that December 15th through the 30th, the end date, that would fall into the previous year in the ACA world, not in the accounting W-2 world. So you'll run this report, and this report's going to show you everybody that you need to be offering. If it comes out full-time, if you have a larger company, you might have several people in here on any particular month. But if this report shows anybody that's full-time, you need to then offer them that coverage. And of course, you have that administrative period to get that done. And then it tracks that on. So this is the key report that will show you what you have to track. Now, for part, and this, this really starts to come to light when you're looking at the GP, what they offered out of the box. They really offer primarily for the scenario of full-time salaried people is what they handle real well. Otherwise, you have to do a lot of manual changing of codes month by month in a very timely fashion in the HR windows, and you have to really manage this with reports outside that you create yourself on that. But it does very well for full-time single companies that aren't combined companies. All right, so this is what you'd look at, and that's what you'd sign up for. Let's continue on here. Now we also offer some additional capabilities here. The group database setup, this is simply where if you have combined entities, you would list your different databases here that we would run our reports against to combine all the employees together across all your databases. Secondly, we have the FMLA Set-up. So you can track your FMLA right here, start and end date. We can calculate what that means and adjust the numbers to be compliant based upon the FMLA work on there. If you're self-insured, you can import the dependent data, but you can manage that dependent data right here. So you can just add records to that, import imported data as the year goes by. For self-insured, again, you do not have to do this unless you are self-insured. All right, so now let's, we have seasonal employee override set up. You're allowed, and I could send you some more information about that if you request it, the detailed legalese of it. But basically, if you're classified as seasonal, this would be like for the Christmas season in the retail industry, for agricultural workers, for harvesting, et cetera, et cetera. There's a bunch of regulations around that. Those are exempt. So if it's purely, truly seasonal, they can be exempt from being offered insurance on that. Let's see. Let's now talk about affordability and how that is all set up. So what you're going to do is you're going to come in here now to the benefit side, and you're going to select, if you got several life insurance, several health insurance codes in here, you're going to select the one that is the for single employee, the least cost plan, and that's what you have to offer. So we really don't care about all the other plans. We just need to select the least cost plan. We'll check that box here. Okay, so once you do that, then we're going to go into the plan setup. And let's pull up the plan. And keep in mind, once we go through this, first the setup, it might take an hour or two to get through all the setups here initially. Pretty much ready to roll unless you change your insurance policies next year. All right, so what we're doing is we're going to list the, the qualifying, is it a qualifying offer? And by the way, these 6 boxes right here is what is used to determine the line 14 codes on the 1095C on that. So let's look at those. You're going to say, is this a qualifying offer? You could say no. We don't care. We're just going to take the fines from the IRS. We've determined, for us, that works best. So then it would be not a qualifying offer, and you wouldn't have any check boxes checked. Secondly, and then the IRS will just send you a bill, next year. If it's a qualifying offer, does it have minimum essential coverage? Does it provide minimum value? Again, your insurance company, typically these would be checked because that's the whole idea, what you're trying to do. Offer the minimum essential coverage and the minimum value. And then you select, is this for employee? Does this particular policy here, the insurance plan, for employee, spouse, and dependents? It may only be for employee, depends on your situation. Now, based upon these check boxes, that determines all the codes. There's like 12 of them for line 14 in the 1095C. Then for line 16, the safe harbor, what you do is you can, let's come down here. The code, or excuse me, the law was written that you have to be 9.56%. The employee cannot be charged more than 9.56% of their 1040 income. Well, when the IRS got writing their regulations, they realized that employers don't have access to the 1040 from employees. So they came up with some regulations around safe harbor, and they said, all right, you can use W-2 income, you can use their rate of pay, lowest, and that's the lowest rate of pay, like for hourly rate of pay, or you can use the federal poverty line, and that was 11,600 that we showed you earlier. Okay, so if you chose the federal poverty line of 11,600 and you take that times 9.56%, that comes to about $93. So as long as the self-only cost was $93 or less, based upon this measurement method for determining income and affordability, then you're good. You're good to go. This was 50 in this example. You're good to go. Now, if you use the W-2 income, that's the box number 1 on the W-2. So that would have to be 9.56% for that employee's W-2 information, which when you file the report, obviously we have that W-2 information available to us. And then interesting part about that, if someone made $100,000 on their W-2 box, you could charge them up to $9,560 for their share of the health insurance. And by the way the law is written, even if that only costs you $5,000, you could still charge that employee the whole $9,560. Obviously, most companies would not do that, but by law, you could do that. And then the last one is the rate of pay on here. So the rate of pay would be the lowest rate of pay. So if it's $10 an hour, 9.56% would be $95.60, or $9.56. Back office, 9.56%. So you take, their wage times times the hours they worked that year, and take it times 9.56%, and that can't be divided by 12 on a per month basis because everything's done on a monthly, and that cannot be any more than that amount for that policy. Okay, then you need to check if you're a self-insurance company, if that's self-insured. So that determines all those codes in there. All right. So once you do that, then you can come back and we'll just take a real quick look, and this pretty much covers everything. And we're going to go back to the, report. Let me get the right report, Keith. All right. IRS Forms 1095C, and we're going to start with HRIL 0001 to HRIL 0001 and 2017 and print. Okay, so we're back to where we started, and now you can see, based upon our setups, the offer of coverage, the eligibility comes through here. The lowest cost would be printed out here, and then the applicable section here. And keep in mind, this employee just started in October, so he really didn't get a full year's, and he didn't meet the criteria for those particular months also. And we do have on the employee level screen all the data that you'll need for the IRS if you do get audited, and that is on the employee maintenance window. Okay, so I got most everything covered here. Let's go back to here. Again, and this is probably the last slide. So in GP, it doesn't do the electronic filing. It doesn't handle the combined entities. It does handle very well the full-time employees, and that's on a monthly measurement period, but it does not do the look-back measurement period, which is most advantageous to companies who have part-time employees. Doesn't do the eligibility testing or affordability calculations. You have to do manage that on your own. And then to get your monthly information, you have to make sure that you change those codes on individuals on the HR window, and do that in a timely manner so it all gets documented per month. Or you have to go back at the end of the year and edit those on a per month basis per employee to you guys. So, okay, thank you very much for your time today. I hope I covered all your questions that you might have had, or you can sure get together with Alta Vista. And you guys have a good day. Thank you very much. Bye.